Hello, everyone, and thank you so much for joining ADAA's public webinar today, Helping Your Child and Teen Move Past Anxiety. We have some amazing speakers joining with us today. Please feel to submit your questions at any time in the chat or the Q&A. We'll be taking them throughout. We hope that this is a great dialogue and we're able to answer as many of your questions as possible. ADAA is a nonprofit, so if you are able, we would love to have your support so we can continue offering free programs like this. Please note that closed captioning is available in English and additional languages as well, so you can go ahead and turn that on if you do require it. I would like to introduce our wonderful speakers. Today we have Dr. Emily Billick, who is a clinical psychologist and clinical associate professor at the University of Michigan. And we have Dr. Deborah Kissen, who is the CEO of Light on Anxiety CBT Treatment Center and specializes in CBT for anxiety and related disorders. Doctors, thank you so much for being here. We have many caregivers and parents who are all very interested in the topic today. I'm going to hand it off to you, but I would love to start the conversation with the first one. So a kind of very basic foundation to the conversation. What are the signs a child is struggling with anxiety?
Yeah, that's a great question. And I imagine, it can look really different for every individual. There are some common themes that we'll talk about in terms of symptoms that are common across different anxiety disorders. But of course, no two people who have anxiety experience it the exact same way. So that's always just something to keep in mind. So some major things that come to mind when I think about signs that a child may have anxiety are what sort of thoughts you're hearing them talk about. Are they worried thoughts? Are they anxious thoughts? Is this a kid who's always saying, well, what if this, what if that? What happens when this? Needs to know a lot about what's going to happen in the future. So those, again, might be some things to look for in terms of anxiety. What are the physical feelings that your child is reporting? Could be things like stomach aches, butterflies in the stomach, could be headaches and tension, heart racing. All these things may or may not be associated with childhood anxiety. And then the big one that comes to mind for me, and Dr. Kissen, I'll be curious what you think, is the behaviors. What are they doing? And what we hear the most is avoidance. Kids not doing the things that they want or need to do because they're worried something would happen. So those are the things that come to mind for me.
And I think in and of itself, that question, every question is very interesting, but struggling with anxiety, that word struggle is really important because the word anxiety, especially for those prone to anxiety, can feel very anxiety provoking. And in and of itself, anxiety equals bad. And anxiety has a function just like fear has a function. So in the moment, if I'm face to face with a bear, which is strange in my office in Chicago, a bear walked in, but in that moment, I would feel fear. Anxiety always has a future connotation. It could be in a second, I may leave my office and there may be a bear, but it has a what may go wrong in the future, and therefore what can I do to protect myself from maybe not an immediate threat, but a threat that could be a problem. And that could be, oh no, what if I don't do my homework and my teacher makes me stay in during recess? Well, then maybe you'll do your homework. Or, uh-oh, maybe I shouldn't run in front of a car. Good, don't run in front of a car. So we need anxiety for survival, children, adolescents, adults. But what is key is keeping it in check. And anxiety, it's so excited about protecting us, the anxiety circuit in our brain, that it can certainly be overly eager and then leading to more and more false alarms. And so somebody's entering the zone of struggling with anxiety when it's the false alarms, or it's becoming less helpful because it's showing up in a lot of different moments that aren't in fact dangerous. And just like Dr. Billick said, that it's impairing life. So if it's causing distress, if it's impairing functioning, someone isn't able to live life on their terms, that's when they're starting to struggle with anxiety, versus we have to all experience anxiety sometimes to survive.
Yeah, that's such a good point, right? That distinction between what is a normal part of the human experience, and anyone who has clinical anxiety or elevated anxiety or not will experience anxiety from time to time. And there's nothing wrong with that. In fact, it's good. And what it becomes about is understanding, just like you said, Dr. Kissen, when it crosses the threshold to be struggling, and that's subjective.
Mhm.
There's no mark in the sand where we can say you're struggling and you're not. That's about your own experience and the interaction with the people in your life when it's a struggle. And then it's also about trying to fine tune, if you will, that alarm. I like the way you said that, Dr. Kissen, that alarm you have in your body, so that you don't become numb to all of the times when we should experience anxiety, when it's helpful to us. If I walk out into the street and a car's coming at me, I really hope I feel fear and I get out of there. So anxiety and fear, they're not bad. They're not good. They just, well, sometimes they can be helpful,
Mhm.
but we need to be able to fine tune that alarm and use it to guide our behavior when we need to get away from something, and maybe just notice the alarm and not do anything about it when there's no true danger or no real good threat to get away from.
That brings up an interesting question that we received prior to the webinar from one of our wonderful attendees. When is the right time then to go and seek professional help and get a diagnosis?
And that's I'm playing a fidget pen. I look very professional. I'm like, and that is, I highly recommend different fidgets. We'll at some point maybe get to that. But it's a great question. I was just thinking it's a really difficult, I'm sure Dr. Billick agrees, and for myself, to diagnose anxiety in the first session, in the second session. We've gone to school for several years to do it. So as caregivers, I know when it comes to my own kids, I don't have that same objective framework anyway. I wouldn't want to try to figure it out on my own anyway. I think trusting, if you're having a feeling of, I just feel like maybe they could be showing up more for their life, that it just feels like they're just being robbed a little bit or a lot of living on the way that not the way I want them to be living, but they would want to be if it weren't for anxiety. That's enough for you to, I would say these days, especially pediatricians are really a great starting point. And there's a tool called the GAD-7 that's actually kind of required these days. Like they're doing a lot more screenings as part of pediatric visits. So I'm just noticing that a pediatrician, it feels like a really good place to start, of just starting to talk through that, and they can help you with some initial screening. So it doesn't have to be all or nothing of, oh, maybe they have anxiety. That means I need to spend months finding a therapist and then get started and spend all this money to figure it out. You could take a first step forward, attending this webinar, speaking to your pediatrician. You could take small steps forward in starting to answer that question. So I was wondering what you think, Dr. Billick.
Yeah, I think that's such a good point, that it is so hard to know when it's time to seek additional care, and it can be really confusing. So getting some outside perspective can be really helpful, whether that's going to see a pediatrician, going to a webinar like this, like you said. But the other guideposts that you can look for if you feel like you're just not objective about the situation are these pieces about impairment. How much is it messing things up for them about the things that they want or need to do? Those are good guideposts to maybe we need some help figuring out what's going on. I think you made a really good point there, Dr. Kissen, that it sometimes can be hard to distinguish what we want for our kids versus what they want or need for themselves. And as a parent or a caregiver, your instincts are so important, and you do want what's best for your kid, but sometimes our own anxiety can get in the way, and we can start to, want for them what would be best for us. So it is important to take a step back and look at it and just ask from that more objective standpoint of, is this getting in the way of things that they want or need to do? And that would be maybe where I would start.
And what's interesting, as you just said that, I wasn't thinking about this before, but we always start off in my practice, Light on Anxiety. It's a parent session first, because it's really important. It's hard to be spoken about in front of you. And it's just about well-intentioned individuals coming together to share information and get additional information. it's interesting because sometimes it does go to the extreme of parents' alarms going off of, I'm really worried about their social anxiety and they spend a lot of time like reading in the room and they're not going to play dates all the time. And sometimes that might be the parents' own, it could be trauma, it could be their own fears, their own history of feeling neglected. And truly for this child, this is the way that they are living in line with what's important to them, and really looking across all areas of functioning. So academically, maybe they have different hobbies. Someone, well-being is measured across many different aspects of life, but every kid, it's not really in line with who they strive to be, to have play dates all the time after school. And that can be okay, or less so if they naturally would want to do that, but they're not because of their anxiety. So all of these things just say that it's confusing. And the fact that you guys are here trying to get more information, if it was really clear, I'm sure you guys wouldn't be here, because it's a complex question. It's okay to ask the questions and get information and just kind of wade your way through it.
Yeah, I'm gonna hop in. There is, a lot of it comes down to how is your kid feeling and how do we gauge that. But there are many children who may be not comfortable opening up about their feelings or talking about these things. So what tips do you have to talk to children and teens about their mental health?
That's such a great question. I think you framed it perfectly that, we all come into this world with different skills, abilities, and propensities, things that are easy for us, that we want to do and that we don't. And then we live in a society that stigmatizes mental health, which makes it even harder for a lot of kids who may otherwise have an easy or a hard time talking about their feelings to do so, right? So it is normal if your child has a hard time talking about their feelings, their emotions, their just internal experience. And there are a couple of things you can do to hopefully set the environment so that might get easier for them. Some things that I recommend parents do or caregivers do is talk about their own feelings in ways that are appropriate, right? So you have to pick sometimes benign examples that won't scare your child, but it's okay for you to have feelings too. So, I often, I can tell you my own experience, I often come home from work and say, oh, this challenging thing happened today and I was feeling pretty nervous about it. And then I talk through what I did. So I model a little bit of problem solving and how it got worked out. But it's also okay to model that, like, sometimes things don't get figured out. I often model that I made mistakes and I make mistakes with my kids. So that's a nice way of starting the conversation without pressuring them. If it is a part of your family's culture to talk about feelings, that will open, I think, the door a little bit for them to talk about it themselves. So that's the first thing that comes to mind for me. Dr. Kissen, what are you thinking?
I'm thinking even for adults, it's hard to kind of identify, like, I am anxious, I am afraid of being judged at the parent coffee. It's hard to identify the reason I'm feeling irritable or don't want to go to that is coming from avoidance. So luckily, we don't really have to only rely on language to track behaviors as the only way to be able to tell if we're experiencing anxiety. So I really sort of the behavioral approach of maybe used to attend soccer practice eagerly and now a lot more shutting down, or I don't like it anymore, or getting stomach aches or headaches. And I would just say, especially, for a lot of mental health conditions, like being spoken to, like, are you okay? Is there something wrong? Anxiety is the signal, oh no, there's something wrong. So when somebody says, like, are you okay? Or I'm worried about you, that can enhance the signal, like, oh no, in fact, there's something wrong. And so trying to just sort of like mindfully attend and be there and interact and engage and just be open and interested in your child. And you still can document and take notes. So you could still keep a little note of, like, the day of the week. I really like data. And so you could just sort of, like, if you're noticing what feels like an anxiety episode or shutting down, you could just, the time of day, where you guys were going. If there's anything that stands out, I wouldn't do it in front of your child necessarily. So it doesn't have to be, you could do it later in the day, and then when you do speak with someone, you could start noticing patterns, because it's never about just one moment. In that one moment, we could just have this stomach flu, or there's a lot of different things in each moment. But the good news is when we get enough data, we can start seeing patterns, and you don't need to talk to your child about their anxiety to gather that information. And when I think just being open and creating a relationship, easier said than done, that allows for dialogue without judgment, where it's okay to not be okay. And that kind of takes some time to get that trust.
Yeah, I'm gonna kind of take this a little bit of a different direction. You spoke a lot about physical symptoms. I wonder if there is a way for perhaps those who aren't comfortable speaking about their emotions, if we can kind of break it down to more the physical symptoms and kind of start there.
And I'll jump in, and then Dr. Billick definitely after. Once again, shout out to pediatricians who are really wonderful partners, that they're really, especially if you come to them with some data, but like somaticizing. So for a lot of us, we feel our anxiety through headaches, our sympathetic nervous system. When it's activated, we feel a lot of things in our body when we're ready to fight off or run from the bear or freeze. So tension, headaches, stomach aches, and it could be a random migraine, but when those headaches are happening on Sunday nights, or those stomach aches are happening Thursdays before travel baseball, whatever might be happening, of the patterns of the physical sensations combined with life events, it's very, very common for especially generalized anxiety that one, especially a child, you're going to hear it more in what they're feeling in their body. And they really are feeling a headache because there is tension. Dr. Billick, any kind of thoughts on the physical side?
Yeah, I think that's right. I think, that is definitely a clue you can look for if you're not hearing a lot of anxious verbalizations or discussion of thoughts or about that feeling. Maybe that's not the way they're experiencing it, and it's coming out. And these physical manifestations, very common in childhood. And the other can be true too. There's a lot of kids I work with where I'm asking them about their physical feelings of their emotions, and they're telling me nothing. It's all zen inside, and I'm struggling. I'm really, having a hard time. So I think this is where it comes back to this thing that there's no one way for it to present. And if you're concerned, asking your pediatrician about it, because they are such a good frontline resource who can then potentially help you get connected to the next level of care, if that's something that they recommend.
And I think as caregivers, as individuals, that you guys are here, you love them enough to spend an hour of your day with us. So you obviously care enough to be spending your time caring about them. It's really hard, that ability to just open up and mindfully attend to them, because of your love for them, you're gonna, oh no, is something wrong? And so it is a very hard exercise to practice, just being available to them. And I guess if it helps to calm some of your anxiety, to know that childhood anxiety disorders in general are like the most treatable, really, mental health condition, because we do know, and we'll talk more about treatment, but sort of that combination between therapy, medication, like there are so many good things that can provide your child relief. So you don't need to panic, because if it is anxiety, like there's a lot of good things that you can, resources to provide them with, that will provide them with relief. So it can be okay. This isn't like a death sentence that they're going to live their rest of their life in misery in any way, shape, or form.
We have a few comments and questions coming in about the idea of anxiety, getting over it and letting it go. Where does the line between supporting your kid who's struggling and accommodating their needs, and how do we balance that?
Yeah, it's a great question. And I love that people are thinking about it, because it means that you, just like Dr. Kitson said, are like really tuned in to what your kids need. I think that actually the great thing is You don't have to choose between supporting your child and not based on fear of accommodation. Accommodation is a thing to be concerned about. And by that, I mean things that you do to reduce the distress your child is in, that maybe over time may maintain the anxiety. So if a child is experiencing, I'm sure this will resonate, difficulty going to school one day and they're like, oh, I have a tummy ache. Oh, mom, I really don't want to go. I'm scared. And you say, you know what, why don't you just stay home today, right? Totally understandable. And I am an expert in this field and I have felt pulled in that direction before. It is really, really a mother's instinct to, a parent's, a caregiver's instinct to take care of their child and reduce the distress. But that kind of reducing the stress can be accommodation and can maintain the anxiety in the short and long term, can make it worse, right? But you don't have to give up on supporting your child. And I think that is always appropriate. And there are lots of ways to do it. The main thing that I try to communicate to my kids all the time, probably they're sick of it, is that how they are feeling is okay. And that it sounds really distressing, right? That I believe them, how they are feeling, and I believe that it is hard. So an example of this might be the same situation. My kid is telling me, I don't want to go to school. My stomach hurts. Oh, I'm just really scared. I say, that sounds really hard. I'm so sorry. I believe you that you are scared to go. And I know you can do it. And so communicating both validation and support for your child, that what they're going through is real and hard, and communicating confidence that they are up to the challenge. That is sort of like my get out of jail free card, where I want to support my kid, but I don't want to accommodate and make the anxiety worse.
Yeah, I just knowing, and I think you could say things to your kids, sometimes they're listen to you or not, but if you're sort of sending that signal that I love you too much to allow anxiety to bully you. So like, it's sort of like if there was, well, we'd want to give them the tools to handle their own bully, which we're going to, but like, if there was a bully robbing them, taking their lunch, and it's like, I love you too much. I'm not going to let someone take your lunch. It's like, I love you too much to let anxiety take away soccer, because I know you do love soccer. And so, and we're a team together. I love you and I believe in you. And even in certain moments that your brain is all on anxiety and you don't know that I have your back, like I know I have your back. As hard as this moment is, like I'm doing this because I have your back and care so much about you. So just kind of holding that truth.
And I'm just seeing
the pain go away, but it makes it a little bit easier to support them through this. Emily was.
Yeah, no, I agree with everything you said, and I love that language. And I'm just seeing someone's response to it in the chat saying, what if the child does not feel confident to overcome the hard, right? So I said my example would be like, I believe you, I see how hard this is for you, and I know you can do it. I'm expressing confidence, but they don't feel it yet. That is so common and understandable. And it may not always be the case that they are able to do it yet, but your job is to communicate your confidence that they can. Because if they don't believe that they can, and they see that you don't believe it either, that is the thing that will undermine the confidence the most. So there may be, lots of language like Dr. Kissen used that might help you get a foot in the door toward the hard thing. They're not always going to be able to do the hard thing. But at the end of the day, you want to be communicating the confidence. And sometimes I will admit, you might be communicating the confidence even when you don't have it, right? It's a little bit fake it till you make it. I'm not sure that they can do this because I've never seen them do it because they're so scared of it. And I know they won't be able to do it if I don't communicate that they can. And so I'm going to, really stand my ground. I know you can do this. Maybe this time we'll do it together, but I really believe that next time you can do it alone because here are all the millions of hard things I've seen you do in your life. So I hope that answers that question.
And I would say by definition, they are not going to be, because if they're confident that they got it, then they're not experiencing an anxiety about disorder in that realm. Because by definition, the anxiety is saying, you are not okay. You don't have this. Everyone's gonna laugh at you. You're gonna fail. You're gonna get a disease if you touch that. So like they definitely in that moment don't feel confident of that next thing being okay. And so, and you just also have to be careful how much, it's okay to keep saying things, but don't be frustrated when they don't hear you, but you could say it to yourself too, because it's not bad to say things in this moment, but like when a brain is on anxiety, they that part of the frontal cortex isn't necessarily listening. But sometimes I'll just say, I'm going to hold the hope for you. Like, you actually, the good news is you don't need to believe you can do it to get better. You just have to take the next step forward and the feelings will catch up. So the good news is you don't need to feel confident that it's going to be okay. I know you don't.
Great. So when is it time to incorporate therapists and bring them to get clinical treatment, or finding other resources that have kind of mental health ability or resources available? When do you take that next step, and how do you talk to your kid about that next step?
I'm going to let Dr. Billick answer this, but Sasha, question: ADA has a wonderful resource that they created with the Reach Institute that has a screening tool that maybe you could put in the chat
Sure.
box. I think it has a link to the SCARED assessment, and if not now, we could send it later, but through ADA and the Reach Institute, they have a couple of just ways to get at levels of anxiety. So, but Dr. Billick, I'll let you jump into the.
No, that's great. I mean, and it dovetails nicely with what I'm thinking, which is there's a lot of different ways where you might come to that decision as a family, right? You might have had a conversation with your pediatrician. You might have had a conversation with a teacher at school. You might have just noticed some things on your own, or it's some combination of these things, and you're starting to feel like it's time to do something more. A great next step is to do a measure, and probably if you do end up at a therapist's office, they will give you some measures, so it can be good practice for that. And a lot of these ones, like the SCARED and the GAD-7, they have some norms. So you can get a sense of like, well, I got this number, what does it mean, right? You can get a sense of like, oh, this is a little bit on the higher end. It might be time to look for some more support. So that's one way. Again, I always come back to this idea: is it really getting in the way? Are you starting to see impairment, just elevated distress all the time? Certainly, if the child is asking for it. Sometimes I have patients come work with me who say, I've been asking my mom for 3 years to come see therapist. So don't wait 3 years. Get on those wait lists now. And that can be the first step. Is sometimes, unfortunately, right now, access to care is rough. So you can get on wait lists. You can go to Psychology Today. You can go to different, I think ADAA has a Find a Therapist tool you can use, and look for someone who's, of course, in network if that's necessary for you, and hopefully who's providing evidence-based care. We can talk more about what that is in a second. The only other thing I'll say is, if you are waiting for a little bit while you're on wait lists or whatever, for trying to find the right fit, there are a lot of self-help materials guided toward parents and caregivers. So books about supporting anxious children, which I'm sure we can share some resources for, and then books and workbooks geared straight towards kids and teens. So if you are on a wait list for several weeks, or hopefully not, but for months, then you can certainly get started in the meantime.
And in terms of, well, I guess in terms of when is it time, I think the sooner the better, just really for everybody. Why not have a toolbox of recognizing when you're feeling anxious, recognizing what are your go-to, we could call them safety behaviors or compulsions. When I feel anxious, I tend to avoid. When I feel anxious, I tend to maybe overly try to get work done. I think getting to know as early as possible your patterns, like these are the ways I'm going to challenge anxiety. So even if your child isn't officially meeting criteria for an anxiety disorder, like who couldn't benefit from a little extra coaching? There will be moments in life that are going to be challenging. And so if it's a resource available, and I really kind of using the wellness model of, it doesn't mean you're sick or there's something wrong, but you could go to the gym, or you could have a trainer with you at the gym, but it's really kind of a nice form of self-compassion to have someone there supporting you, saying like, okay, you've got this, even when you're feeling more tired and you're feeling less motivated. So removing some of the stigma. And then in terms of resources, because it can be challenging to find mental health providers. So talking to your pediatrician, schools, speak with your child's school or see if they would be willing to be their own advocate. Sometimes parents are concerned, or in the past, more so, like I want to kind of separate out their mental health from the school. I don't want the school to maybe see that there's a problem. I'm noticing maybe less so over the last couple of years, but schools can be great resources and counselors available. Also, there are a lot of online treatment groups for children and teens, and some of the good things that came out of pandemic in terms of new resources. So some group-based treatment where a teen can meet others that are also experiencing some anxiety and learning tools. So there are more creative ways to get resources. If you don't find do you have resources for those groups? And we'll definitely kind of go through these questions. And I have no relation to, for example, Charlie Health. I just met them at ADAA. They have online teen treatment. So that just came to mind. So we could send a list of resources.
We're happy to email everyone afterwards with some.
Yeah.
And if you have any questions, you can always go to adaa.org, and we have tons of resources and links available.
Yes, but a little creativity. There is stuff out there, just maybe not the first resource you try.
We've been touching upon treatment throughout this whole conversation. I think if we can touch upon what are the best evidence-based treatments available for children anxiety.
Sure. Yeah. So the good news is, like Dr. Kissen said, anxiety is among the most treatable mental health concerns, and it's been studied a lot. So we have some amount of confidence in what we're going to say here, which is that psychotherapy, evidence-based psychotherapy for anxiety, is cognitive and behavioral therapy, and almost always probably incorporates some amount of exposure therapy. That is my statement. So I'll let Dr. Kissen speak if she feels differently. And there's been a lot of research that there are medications that can help even among youth, and that sometimes for some kids, the best treatment approach is a combined approach, both medication and psychotherapy. But if you're someone who is hesitant about medication, you can start with psychotherapy and just talk with your provider about if and when it would be appropriate to add on a medication trial.
So I got stuck reading a little bit of the comments. I might have missed the first sentence of what you said because people are saying such good, interesting things. But in terms of empirically supported treatment for anxiety and related conditions, Dr. Billick and I both specialize in cognitive behavioral therapy, CBT, which has the most empirical support, research backing its effectiveness, and the CBT. So the C is the looking at the thoughts, the B looking at the behaviors, and it's a very hands-on, action-oriented approach. And so by noticing the thoughts, challenging some of those anxiety thoughts, coming up with more realistic appraisal. So it doesn't mean we're not trying to convince ourselves like, oh, if the anxiety thought is everybody hates us, everyone's going to hate me at the party. We don't want to challenge that with it. Actually, everyone's going to love me at the party. We really want to just actually, what's the realistic? Like some people might not like me, and then some people will find me okay to be around. So the key is we're going from those catastrophic thoughts to identifying and then finding a more balanced approach. And then really the secret sauce in cognitive behavioral therapy is this exposure piece that Dr. Billick said. So what we really want to do is, it's one thing to say it's going to be okay, but the brain likes to learn through experience. So if somebody's fearing, oh no, if I touch this table, if I knock one time, something terrible is going to happen to a loved one. Okay, well, we're going to teach the brain saying that's not maybe realistic, or that's not going to happen. But when we actually practice making contact with fears and then noticing what does occur, what we notice is, number one, we can handle things. So anxiety says it's going to be terrible and you won't going to be able to handle it. So by doing exposure, learn that, okay, I can handle this discomfort. I might not like it. And number two, oh, wow, I guess that was a false alarm because the feared consequence didn't occur. So that's kind of that exposure piece. That's such a critical ingredient in moving past anxiety disorders.
Yeah, exposure is really interesting, and I find fascinating and wonderful because it's so wonderful to have a treatment that works so well, but it's tricky because it requires someone feeling anxious and doing it anyway, right? And that's hard as a therapist to ask someone to do, to make themselves feel anxious and do something anyway. And so then, of course, it's 10 times as hard as a parent or caregiver to ask your child to do something on purpose that makes them feel anxious in order to get past it. To, of course, the other side of that sentence is really promising, to get past it, to have a really wonderful, full, rich life. So something that I tell myself whenever I'm noticing myself getting a little bit nervous about doing an exposure, or I ask caregivers to think about, or people that I'm training to think about, is think of something in your life that used to be hard, that used to make you anxious, because again, every person has anxiety. So you're not off the hook. Something in your life that made you anxious that is easier for you now. You might still feel some anxiety, but it's easier for you now because you did it a lot. And going back to what Dr. Kissen said, I think oftentimes we want to reason people out of their anxieties. We want to say, but you'll be fine on the plane. The rates of plane crashes are almost none. Or we want to do that to ourselves. Like, come on, Emily, you're not going to make a catastrophic mistake in the webinar and it's going to be fine. Sometimes some of that self-talk, that more helpful self-talk can work. But really, I think we know we sometimes have to experience it ourselves as a parent. My kids don't listen to me if I tell them. They go off and make the mistake themselves and learn from the mistake. Exposure is like that. One of the most effective ways to learn is just by doing. So if you can think of some time in your life, could be maybe learning to drive, where you felt anxious when you were first starting it, and now hopefully it's easier. Public speaking comes up a lot. Talking on the phone. That's one for me where I do it all the time and it's gotten easier, but it's not zero. So I think it's important to remember these things get easier. We learn we can do them. And sometimes the anxiety comes along a little bit anyway.
We're having comments about negative self-talk, and I think that comes into play here, where we start to doubt ourselves and our ability to do it. What tools do we have to combat that negative self-talk, kind of turn that around to get them to do the exposure or do the thing or overcome their anxiety?
Yeah, so negative self-talk, it's also super common. So there's nothing wrong with having negative self-talk. And I think just as a parent, if you hear that negative self-talk in your kid, it can be really tempting to correct it. I think I would take an approach of more like our first reaction to a situation, our first thought in a situation is our immediate, our automatic interpretation. And sometimes that's going to be negative, and that's okay. Judging ourselves for having negative talk or getting judgment from others for having negative self-talk, there's probably not going to be that helpful because we can't really control what happens automatically, right? So what can you do then if you are noticing in your kid that comes up a lot? I think validating, man, maybe it's again, maybe it's a get out of jail free card, but I really just don't think it can be overused. Just telling your kid, I'm sorry you're feeling that way. That sounds really hard. I believe you, in whatever language actually sounds believable coming from you. And then after you validate it, you could ask some questions like, do you want to talk more about that thought? Sounds really, if I was having that thought, I would feel really bad too. I usually, just like Dr. Kissen said, I usually try to stay away from trying to convince them of any other thought, because that's a great way to get them to dig their heels in deeper on the first thought. They're going to believe it even more because my mom told me that I shouldn't think this, right? So being curious about the thought, I'm curious if that's the most helpful way to look at the situation, rather than whether it's the most accurate. Because again, if you're trying to argue facts with them, they'll come up with a reason why it's likely. But is it helpful? Is it getting them where they want to be? What else could be going on in the situation? I wonder if something else, just curiosity, non-judgmental curiosity, and playing the long game. Never trying to change the thought as a parent, especially in the moment, that you might win this battle, but lose the war, right? So just being curious about their thoughts, trying to teach these skills in a subtle way. Again, I really lean into modeling. I might say out loud, like, oh no, I dropped the salad. It's everywhere. I'm an idiot, and be like, well, wait, no, it's normal to make a mistake. Like modeling, going through that negative self-talk and coming at a more balanced thought. So the kids can hear that.
Yeah, I really like how Dr. Billick is kind of separating out as a clinician what I might do, and then as a parent what I might do, and the effectiveness. It's an unfortunate thing, but it's just not the same. It's not going to get the same reaction. So even if you guys, sometimes I'll do something in session with a client, I'll say something and the kid will be like, yeah, that makes sense. The parent will be like, I just said that on the way there and you were like yelling at me that that's so stupid. And it's just the way the love of being a parent goes, that it's harder to hear because that unconditional love can come first. So it's not that you're not saying the right things, but sometimes just sort of saying less in those moments. So give an example of if a child like, I failed that test and oh, I did terrible and I failed that test and I failed that test. And they're really trying to hook you, because if you then say, well, no, you didn't. Like I you always say this, and then always, after you end up with a 90, like you've been through this before, or I saw you study with your practice test. No, I definitely, and if you try to say anything like that, like, no, this time is different. So they're feeling anxious and they're kind of trying to get you to, it's not manipulation, but it works. So you do it, where if they say like, I'm just so dumb and I failed, then you're like, well, no, you're not. They're trying to get you to relieve that anxiety by changing the channel on their brain, but it doesn't really work. But it is distracting because now they could just be annoyed at you and not have that thought. So ideally what we want to get for all of us is to really start identifying what are our core maladaptive thoughts that are the most common frequent flyers. So, and it might be like, I'm going to fail, or everyone hates me, or what's your flavor of catastrophic thoughts? And kind of learning to play with them. And eventually, and as a clinician, I can do this, not as a parent. Like I might, like if it's that thought again, and something we've identified, I have my like blah, blah, blah pen. We'll see if this works. But like, so when that thought comes up, like you're going to fail, you failed. The goal is for it to eventually just sound like background noise. And I might even play this pen. Yeah. So like eventually not take it so seriously, like, okay, yeah, blah, there's that thought again, just trying to protect me, but it's not always an accurate predictor of what's going to happen. We might even have mantra wear, like make a bracelet of something that like, I've got this, even if I don't feel like I do. So in that moment, we all feel very fused with that catastrophic thought. So it's hard to see past it. So it's helpful to have could be a screensaver on your phone, or different ways from the outside to remind yourself of something that's a different way to look at a situation. Easier to do as a therapist.
We've been talking a lot about parents and their role in it. How can teachers, coaches, external adults who are in the lives of these teenagers and children start having these contributions to their mental health?
It's a great question. And, it's going to really vary by your child and their relationship with the people in their lives. I think it never hurts to have supportive role models in adult role models in a child's life. And oftentimes when I'm working with kids, I'm looking for those, like, who are the people you look up to? Who are the teachers you feel comfortable talking to? The coaches, maybe it's an aunt, whomever it is that you trust, who's a good role model. So I think helping identify those, and if you can, sharing what's going on. We want to respect our kids' confidentiality, but we also know that these disorders thrive in shame and silence. And so if there's a way to together decide, hey, we're going to loop in your English teacher about this because you trust her, she's someone you can go to during the day, going to be that jolt of, like a reminder of what we're working on. School days are long and they're intense experiences with so much stimuli. That's hard to hold on to the few nuggets you hopefully got from your therapist one time that week. So having other people infused who are aware of, the skills you're trying to teach, I think that is really invaluable. So that's one thing that I do recommend to the kids I work with directly and their parents, is like, who are trustworthy adults who can show up for this kid and be good role models that we can maybe loop into some of the work we're doing.
And the good news is, if when you identify that trusted adult, it doesn't have to be you as the primary caregiver, a trusted adult, and maybe like a good anxiety workbook. So if there's like a child anxiety, there are so many great books and through ADA that they have recommended workbooks. It could be an activity book, if that name could sound less appealing, that if the trusted adult has a copy and the child, and just kind of going chapter by chapter, and as long as, if that's while you're waiting to get in with a provider, even as a starting point to start learning to play with anxiety, you can make a lot of progress with an adult that the child isn't feeling resistant to interacting with on this front. And so it could be a coach, it could be a teacher, it could be a family member. Yeah.
There's one comment I want to just quickly address from the chat, which I'll just summarize briefly because I hear this all the time. Like, what do I do if my child's response is violent or aggressive when they're anxious? And so I have a couple of pieces to that. One is that that's not something we should have to manage alone. And that's probably time to seek out some support and help from a professional. But the other piece is coming back to this question about, like, how do I support my child? I care about them. I believe them that they're anxious and they're hurting, the cat, my family, whatever. It is actually part of support is saying the way you feel is okay, some behaviors are not okay. And it is totally appropriate to set limits around what behaviors happen. Now, enforcing those limits can be tricky, and that is where it does benefit you to have a therapist or other professional on your team working with you through that piece. But I just think it can come up a lot of times, whether it's with aggressive behaviors or other types of anxious behaviors, could be OCD. I can't keep washing their clothes 10 times this week, and I know it's because of OCD. What do I do? And it's totally appropriate to have limits while also not blaming the child for having the feelings and the distress that they're experiencing.
And yes, to everything Dr. Billick said, it's interesting. My questions are always when speaking with parents, like when they describe physically violent. So there's violent, like kicking a chair, and then there's violent injuring a family member. There's punching, there's kicking a wall, and then there's like pulling down a door and ripping out a toilet. And so, I think everyone needs their level of when how they're defined, like what this isn't none of these things are healthy or good, but what level is it time to find a partial hospitalization program? What level of support is necessary? I do find, so someone had a comment regarding like maybe hitting siblings or yelling, and so sometimes siblings I always say, like, don't poke the bear, and so there is sometimes like a bi-directional element on the sibling relationship of one sibling might know that the other sibling is kind of entering that zone and then kind of say certain things. So you could even reinforce the other child, like, okay, when they're entering that zone, and they normally know it with each other, like, I'm going to give you a point every time you actually go into the other room. So like you actually practice having self-control, because it is hard. Sometimes it's interesting to make your sibling have a meltdown. So you could also reinforce the other child for doing something different in those moments too. Because really the key is when someone's in a really anxious fight or flight mode, their brain is saying danger. That's not a time to back off, you don't want to have conversations. So if there's a way when someone's feeling particularly anxious to give them some space to settle into themselves, they'll be in a better place. But it's never okay. It's not just not okay to be a dangerous member of one's family. So it's hard to know in each situation what we're talking about, but they all can be handled. So yes.
How does the whole family come together for psychoeducation? Because if we're saying it impacts the parents, it impacts siblings, what are the steps for the whole family to start breaking the stigma of mental health? If the parents struggling, how do they talk about their experiences? This is kind of a multifaceted question here.
Yeah, I mean, and there's no single right way to do it. You're going to find what's right for your family culture. I come back to this idea of breaking the stigma and the silence around it, finding ways to bring it up that are non-threatening, not laden with judgment. Can you talk about your own struggles in non-judgmental and non-threatening ways? And again, ways that are not going to scare your kid. It's hard to determine, but it's important to talk about age-appropriate struggles for the kid, right? We don't want to dump and unload all of the things that are going on for us. That's not their burden to bear. But it can be appropriate to say, sometimes I have anxiety and it's really hard and I'm learning to cope with it. Like things like that are not going to be threatening to the kid, and it will start to send a message that we can talk about our feelings here, we can struggle with things, and we can work on them. So that might be one thing, but of course, it will differ by what's right for your family, and always seeking out some education from reliable resources can be helpful in just destigmatizing it.
And it's a great question. All these are very good questions, just because it shows the insidious nature of anxiety. And it's never just the child is the identified patient. They are doing things wrong, but we all interact with each other. And when party A reacts one way, then party B reacts one way, and we impact each other as a unit. And so, and if there's sort of the identified patient, the anxious child, it could just feel worse to be like, I am the problem. Everyone would be okay if it weren't for me. And they might be struggling a little bit more than everyone else, but we all interact in a way that have created the situation that we're in. So even just sort of having a reboot, like identify like a family-wide, like the way we are all relating is not super fun, and we're just going to do a reboot. We're not exactly sure what that's going to mean, but like, what is one thing we each can do that will just kind of create change? And if each person can be that change over that, like, I can't think of anyone who can't identify something that if they did could make things better. And I think that just shows that we are all in it together, and we all have areas to grow.
We are kind of getting towards the end of this session. There were so many questions that we can't get to today. And I think this is always such a full conversation based on a lot of individual experiences, and find comfort in that you're not struggling alone. There are others here who are going through similar experiences. Dr. Kissen, Dr. Billick, I was hoping you guys can give us kind of one key takeaway or a few key takeaways that a caregiver can walk away with today.
I would just, what's coming up is just hope that, I can hold the hope for you guys. There are just moments when it might feel like, how is my child, how are they ever going to be okay? Like, how are they going to live a full life? How are they going to find joy? And in those moments, really all potential could feel like it's melting away. And the good news is, like, the very fact that you guys are here, that having someone in their corner, there are really good resources to help them retrain their brain to learn to, better regulate some of those false alarm moments. So there is a lot to be hopeful for, even if in certain moments it's hard to find what those are. So it will be okay. That's my takeaway.
Yeah, I love that takeaway. And it resonates so much. I love that you said that, Dr. Kissen, of I can hold the hope for you. I say that to my patients all the time. Maybe I got that from you and I didn't even know. So I think that too, right? Hope it is not something that someone who's struggling with anxiety, or maybe even the family system, has a lot of. So finding the people who can hold on to that hope for you and help you do the hard work, help the child do the hard work to get out of, the tough time that they're in. I think that that's very valuable. Other key takeaways that come to mind for me is that, anxiety is normal. It's not dangerous. It feels bad, and we actually don't need to do anything to make that feeling go away. That we can feel discomfort and be okay. Not that we want to. I feel anxious sometimes and I'm like, oh man, I want to do something to make this go away. You don't want to feel it, but if you know, and if you build up for your child that confidence that they know they can feel uncomfortable and be okay, that will generalize to so many things in their life. It will hopefully help them with their acute issue with anxiety, but think about willingness to take on challenges in the future at a job, in college, in any sort of situation that is really driven by the sense of I can experience discomfort and be okay. So that's one piece of it. And then the other piece is what do you do as a parent or caregiver when you see your child in distress, and trusting that you are the expert on your child, but someone else might be the better expert in how to treat anxiety. So you don't have to know all of those pieces yet, and you can get help if you need it. And that, just validating what they're experiencing, that it's really hard to feel that way. You don't have to fix every problem that your child has, even though we are hardwired to want to do so as caregivers. So noticing that impulse to fix it, and instead, if you can pivot and just align with them. This is really hard. I'm sorry you're going through this. I believe that you can do it. I know that you can do it. And, we'll work on it together. We'll get the help that you need. Even if you don't have all of that confidence or that hope in that moment, hopefully being able to anchor yourself in that knowledge that the resources are out there, whether they be the self-help books or the workbooks or experts, therapists or psychiatrists or pediatricians. There are people out there who want to help, and it may take a little bit of time to get connected with the right person. But if you stay anchored in that, I think like Dr. Kissin said, I think you'll be okay.
We are walking away with hope, is what I heard.
Can I say one more?
Go ahead. Yeah. Of course.
Okay. I was going to tolerate the distress of not speaking, but I failed at tolerating the distress of it. Is that another great thing about children, adolescents, and children getting treatment for anxiety is that they learn so much quicker than adults. So I'll have sometimes 2 sessions with a kid with maybe severe OCD and quickly understanding, oh, okay, that's a false alarm. I don't have to do that. And I'll say, how do you just figure that out so quickly? I've been working with an adult maybe for 30 sessions. So as quickly and exponentially as anxiety can set in, also the healing and the learning can happen really quickly because they just are sponges and they're taking it in. And so if only we adults could learn as quickly as they do sometimes how to use new tools. So that's another thing to be hopeful about.
Thank you so much, everyone, for attending. Dr. Kissin, Dr. Billick. I think all of our attendees are walking away with some great tips, some great things to add to their toolbox, and to start incorporating into their daily lives. For everyone who is interested in additional resources, as we had mentioned, ADAA does have a Find Your Therapist directory, which has evidence-based practitioners who are there to provide the support for your child and teen, so know that they are not alone. We also have a free online support group in a few different languages, focusing on a few different areas, generalized anxiety, MDD, just anxiety, for them to go and find a community to chat. We also have a series of webinars just like this one, covering all sorts of topics. So if you want to keep learning, we invite you to do so. Beyond that, thank you all for being here today. If you have any questions, please reach out. ADAA is a great resource. Our wonderful members are amazing resources. So thank you so much.